Hello everyone, welcome back to my channel. Today we'll be talking about post-traumatic stress disorder. So post-traumatic stress disorder is a condition that arises after an individual has been exposed to a traumatic life event. Example of this traumatic life event could include things like abuse, war, accident, armed robbery attack, crisis, anything that affects someone emotionally or physically, anything that causes or makes an impact in someone's life, a negative impact in someone's life, is called trauma. Now, is it everyone who has had this trauma that suffers from post traumatic stress disorder? The answer is no. So, for someone to be said to be suffering from post-traumatic stress disorder, first of all, the person must have been exposed to one form of trauma or the other. What are the symptoms of someone suffering from post-traumatic stress disorder? Uh, any individual suffering from post-traumatic stress disorder displays signs such as nightmare. The person goes to sleep and they suddenly wake up due to nightmare, due to bad dreams. Another symptom is the person displays some form of avoidance behavior. Like, let's say, for example, someone who was recently or who has been attacked by armed robbers, maybe in their houses or on their way traveling. This person will now have problem falling asleep. They have problem. Okay, let's say it's on their way traveling, they are attacked by armed robber. Anytime you want to discuss about anything that has to do with traveling on the road, the person starts being afraid, the person starts withdrawing, the person stops the discussion, don't want to engage in any type of conversation that has to do with traveling, any conversation that has to do with armed robbery. You see the person panicking, the person is having some kind of palpitation, the person appears really, really scared and anxious. Is there a treatment for post-traumatic stress disorder? Yes. And just like every other mental health condition, the treatment involve basically psychotherapy, and in some other cases, medications are given. So this medication usually given is to treat the anxiety that comes with the traumatic experiences, and also to help, because I said that sometimes these people don't sleep. People who suffer from post-traumatic stress disorder may find it difficult falling asleep, so they are placed on medication that's going to help them sleep. They are given anxiolytic to help suppress the anxiety, or to help and also they may be given antidepressant to help improve their mood. For the psychotherapy, usually the person is introduced to cognitive behavioral therapy, where this person is usually taught or educated on how to overcome their fear. And in some other cases, this individual could be exposed to the fear item, to like that is exposed to that thing that they are scared of. And constant exposure to them makes them to understand that, oh, whatever may have happened could be just a coincidence, and doesn't mean that there's going to be a repeated event of that. Like, let's take for example someone who is afraid of traveling through the road because they have been attacked by armed robber before, or because they have had an accident. The person may subsequently feel scared going through the road. Now, does that mean the person must travel by air every time? No, because there are places where you can just go by air. You need to go by road. So what do you have to do? You have to build this person psychologically. You have to build this person mentally. Sometimes the person may need to travel with someone on the road so many times, like constantly exposing the person to the road. This helps the person to build more confidence, to have the feeling that, oh, accident does not always happen every time. And with that exposure, with that therapy, the person build back their confidence, and then the fear is likely going to reduce, and the person will resume their normal everyday life. So if you enjoyed this video, like and follow, because we will continue to discuss mental health condition one after the other. Thank you very much. I remain your humble self. Happiness, Ude.